So good afternoon everyone. I am Jaira May and Agwarin, your nurse for the day. And of course, I'm going to introduce myself to the patient so she will aware that I am her patient. And also I'm going to ask her personal information such as name, age, birthday, and location. So hi ma'am, I'm Jaira May and Agwarin. I am your nurse for the day. Can I ask you a personal question? Ma'am, what's your name?
Jamie Durham,
Okay, Jamie Verbano. And what's your age po?
21,
21 years old. Birthday.
and
Happy birthday. What's your address?
San Pedro Laguna.
Okay, thank you ma'am for the cooperation. And then after that, I need to assess the patient, of course, safe and quality of nursing care. Number one, assess the clients for the presence of the congestion in auscultation of the thorax, and the note client's inability or ability to remove the secretion through coughing. And also, the next step, I need to observe for the vitals. Observe sign and the symptoms of lower airway obstruction requiring nasal and oral suctioning. Of course, secretion in the airway, wheezes or crackles or inspiration and expiration. Restlessness, reflective cough. Of course, unilateral pneumonectomy and the lobectomy or bilateral absence of the diminished breath sounds, of course. And then, ma'am, I'm just going to auscultate you po, your chest. I didn't see any abnormalities. And let's proceed to the planning. Of course, I'm going to prepare the equipment or supplies. The first one, I need a bedside table, which is in here already, and also the suctioning catheter of appropriate size. It's in here. Plus the sterile basin, which is this one. And then after that, approx 100 ml sterile normal saline, which is this one. And also clean towel, sterile drape from the kit. Here's the clean towel. And also portable wall suctioning of apparatus, which is this one, the suctioning devices, plus the connecting tubing, and then mask and micropore tape. This is the micropore tape. And also water soluble lubricant and sterile suction kit can be used if available. Bandage scissor, which is this one. Plus, of course, oxygen tubing and valve mask, water receptacle, and sterile gauze. So, these are the materials that we'll need it. And then, of course, I need to communicate to the patient, and so she will know the health education, or she will aware for what I am doing. So of course, the first one, I need to explain the procedure for the patient. So for the implementation, safe and quality nursing care, of course, I need to wash my hands and also turn suction device on and set the vacuum regulator to appropriate negative pressure. So imagine that I already washed my hand, and then after that, nagpunas ako ng kamay and I'm going to open or on the suctioning device. And then, management of resource and environment. If using sterile suction kit, I need to open the suction catheter. And also take note, do not allow the suction catheter to touch any unsterile surface. So unwrap or open the sterile basin to the table and be careful not to touch inside the basin. Fill with about 100 ml sterile normal saline. So this one is the catheter, and then this is the sterile saline for 100 ml, and I'm going to put and then after that I'm going to apply the sterile gloves to each hand and designated the sterile, which is the dominant hand, and the non-sterile, which is the non-dominant hand. Of course, after that, we're going to apply the sterile glove. And then pick up the suctioning catheter with the dominant hand without touching non-sterile surface. Pick up also the connecting tubing with non-dominant hand. So this is my dominant hand and this is my non-dominant hand. So here it is. The equipment, if it's functioning properly by suctioning a small. So I guess it worked properly. No need to worry. And also the 6-1 hyperinflate and or oxygenate clients before suctioning. I'm going to put her oxygen. I'm going to remove her oxygen. And then after that, still safe and quality nursing. Without applying suction, gently but quickly insert the catheter without the thumb and the forefinger into nares using slightly downward slant through mouth. When clients breathe, do not force through nares. Okay, going to like early, and also amount of saline from basin. And then, of course, after that, without applying suction, gently but quickly, insert the catheter without thumb and forefinger into nares using slightly downward slant or through mouth. When client breathes in, do not force through nares. So, the next one, insert the catheter until the resistance is met, then pull it back 1 cm, and then apply the intermittent suction by placing your releasing non-dominant hand thumb over the catheter. Slowly withdraw catheter while rotating back and forth between the dominant thumb and fingers. Encourage the patient cough. And then after that, replace oxygen delivery device and encourage the patient to have a deep breath. And then rise the catheter and connecting tubing with the NSS until clear the continuous suction. Place the oxygen delivery device, encourage the patient to deep breath. So, ma'am, nakakahinga po ba kayo ng maayos?
Yes po.
And then replace oxygen delivery devices, encourage the patient to breathe, rinse catheter and connecting tubing with NSS until clear and continuous suction. So I'm going to rinse the catheter. Course, repeat steps to 6 to 11 as needed to clear the secretion and allow adequate time, at least 1 full minute between the suction passes for ventilation and reoxygenation. And also assess the patient cardiopulmonary status between suction pauses or suction passes. So when the artificial and tracheobronchial trees are sufficiently cleared or secretions, perform a nasal and oral pharyngeal sanction. When catheter is contaminated, do not reinsert them into ET or TT. And then when the suctioning is completed, roll the catheter around the finger dominant hand. Pull over the gloves inside and the catheter remains coiled in the glove, and pull off the other glove the same way. Discard and appropriate receptacle. Turn off the suction device, which is this one. I'm going to put this one into a proper waste. And I'm going to turn off the device of suctioning. And I'm going to reposition the... Pwede po ba kayong umayos ng pwesto para maging comfortable kayo? And then, after that, remove the towel and discard the remainder. Remove the towel and discard the remainder of NSS into appropriate receptacle and wash hands. So I'm going to remove the towel and I'm going to also wash my hands. Already done. So that's it for the sanctioning. So for the evaluation, of course, you need to record management, record the following: respiratory assessment before and after the suctioning, sizes of the catheter, and use amount of negative suction, pressure, and duration of suctioning period. And also the routes used to suction, obtain and odor, amount, color, consistency, frequency of suctioning patient, tolerance of procedure. Because always remember that if ever what will happen to the patient, it's your job as a nurse to take care of them. So you are the reliable one for their health. That's all. Thank you.